Hi friends, in this video, I would like to discuss about Salter-Harris classification to diagnose or to classify the physeal injuries or growth plate injuries which is common in children. In children, the parts of a growing bone includes epiphysis at the distal end and physis in between epiphysis and metaphysis, and just proximal to physis there is metaphysis and proximal to metaphysis there is diaphysis. And the physis or growth plate is in between epiphysis and metaphysis. In female, the growth plate ossification occurs at the age of 15 and 16, and in male it is up to 18 and 19. Here is the Salter-Harris classification. Out of total fractures, 15 to 30% injury, we can classify it as Salter-Harris as in children. This is the normal one. Here we can see the growth plate is in between epiphysis and metaphysis. And the type 1 is straight across. That means by the mnemonic SALTR, we can learn the Salter-Harris classification. And here in type 1, it is straight across. And this particular injury confines of total 7% of the total injuries, and which is very common in younger children. And the prognosis is good, and we can possible to manage it conservatively. And this particular injury may be occult in X-ray radiologically, so that the clinical diagnosis is more important. And coming to type 2 injury, here we can see through the metaphysis, we can see the fracture. Just proximal to growth plate, we can see the fracture. And type 2 is the most commonest injury of Salter-Harris classification, total 75%. And the prognosis is good, and it is possible to manage conservatively, which is very common in the age group about 10 years. And type 3, which is through the lower and distal to the growth plate, through the epiphysis, intra-articular injury is occurred, which is up to 10% of total Salter-Harris classification, and the prognosis is bad. This should be referred to an orthopedic surgeon for the proper management. If it is not properly managed, then there will be growth plate retardation. There will be growth retardation. Why? Because the growth plate is affected and it causes functional impairment also. So the prognosis is not good in type 3 injury, so it should be referred for surgical management. And this particular injury, that it confines 10%, and it is also common above the age of 10. And coming to type 4, which is below 10%, this is through or transverse. It passed through the metaphysis and then through the epiphysis, and growth plate is also affected. This injury is also intra-articular. Prognosis is not much good, so that it should be referred to surgical management. And this may occur at any age group, type 4. Type 5, which is very rare, below 1%, uncommon injury, and this is crushed injury. This may be overlooked, so that it is diagnosed when there is growth retardation. So we should keep in mind of all the total 5 types of Salter-Harris classification in children who is injured, so that this classification is very much important. Why? Because if it's not properly managed, then it may affect the growth of that particular affected part. Type 3 injury is common at the distal end of tibia, so that we should keep the Salter-Harris classification and incorporate this particular classification in the diagnosis of fracture of children, and if needed, surgical reference should be given. Hope you understood the Salter-Harris classification. Thank you for watching the video. Thank you.